only news talk radio station covering.
And the message here is no one loves going to the dentist, but it's a lot better than having an emergency ER after going to after having a heart attack, because there are real links between heart disease, endocarditis, which is an infection of the inner lining of the heart, atherosclerosis, which is a hardening of the arteries. And think about it: if you have bacteria in your mouth and you just keep swallowing that, think of hundreds of and thousands of times between visits, that can go into the bloodstream and do real serious damage. So I think people oftentimes just wait until it hurts, and it's too late at that point, right? And so much medical knowledge is really been coming forth over the last decade, just connecting
all of Suffolk County. LI News Radio.
Let's spend a couple of minutes today, by the way. This 20th day of March is World Oral Health Day, folks. According to the World Health Organization, 3.5 billion people suffer from oral diseases, 2.5 billion affected by untreated decay. Now, very important, because a lot of this stuff is linked to heart disease, diabetes, and cancer. Dr. Moshe Glick of the Rivendell Family Dentistry, 15 years plus experience, emphasizing the need for good care here to prevent these types of complications from occurring. Dr. Glick, welcome aboard. Let's spend a couple of minutes here as far as what people need to know. There's a lot of neglect going on. Listen, from my experiences, I always try and get a cleaning at least once a year. I guess I have to kind of move that up a little bit. Maybe twice a year I should. But x-rays and everything else, very important stuff. Go ahead, my friend.
Hey, good morning, Jay. Thanks so much for having me on this morning on this very important topic. Some of the real important things are, a lot of people wait until it's too late. They wait until they feel pain, and that's really a late sign of real problems going on underneath. And there are things, people have heard of gingivitis and periodontitis, and periodontitis is a serious issue that can lead to serious health problems. Bacteria from infected gums can enter the bloodstream through tiny openings in the mouth and can travel through the bloodstream and cause lots of systemic problems, heart disease, diabetes, stroke, linked to lots of some real bad stuff. So, my big message is don't wait till it hurts, because it's really too late at that point. Real damage has been done.
A lot of the stuff that I have found over my years of sitting in the chair goes without some of the symptoms involved. The decay, gum disease, that type of thing, narrow lining of the gums and whatnot, until those x-rays actually show it. And that's why you need to get in and really be seen. But a lot of this stuff comes without any notice, as far as those symptoms that would alert you. And that's part of the issue, I would think.
Yeah, no, you're really hitting the main point. And some of the early things that people will see are inflammation. They'll see bleeding after they're brushing. They'll see blood in the sink when they're rinsing around. And those are the early signs. And periodontitis and real serious health problems. And I've seen it in my own practice where I've had patients come in with they've come in every 10 years, and I've had a patient, this happened a couple months ago. Patient came in terrible pain on a tooth. We took him out of pain, took the tooth out, and just wrote a script up to his primary care physician to do some basic tests. And he ended up he was literally a ticking time bomb for a heart attack. Thank God he was able to get a couple of stents put in and some blood thinners, statin, and literally his life could be changed. Not that I'm a hero, but there's lots of it's a pretty simple thing to do. But again, as I think the message really is, don't wait till it hurts. Go for, I heard you say once a year. It really should be every 6 months.
Yeah, once a year.
Yeah,
no doubt about it. Back in the old days, when we were kids, Mom used to send us to the dentist to, maybe take a look at some cavities that might be brewing. But now it's really about protecting your entire body. Even the certain types of cancer that could really go undetected, but with a checkup, the proper x-rays and everything else, that's what's needed here too.
Yeah, you hit the nail on the head. I mean, cavities, look, obviously people want to be able to chew. There's 178 million people in this country that are missing at least one tooth, and around 40 million people are missing all their teeth. So you can think, everyone thinks of their grandparents in dentures. Nobody wants to be in a denture. So there's two aspects to it. One is the teeth part of it, and as you mentioned, cavities and decay and things like that, which obviously are important. But then there's the other part, and that's why on World Health Day, we really wanted to focus on not just the teeth, and that's why really trying to bring light to some of these other things. You mentioned certain cancers are linked to it. I mean, there's just a growing body of evidence of the link between oral health and systemic health.
So it really goes kind of beyond the brushing and the flossing and everything involved here. What can you tell us, Doc? One final thought here. What can you tell us? That a very simple yet maybe powerful habit that one should adopt today to really kind of significantly improve their oral and overall health here.
Sure. So as you mentioned, brushing, flossing, I'm a big water pick guy. They're really easy to use. They're pretty inexpensive. You can get them at your local drugstore. So I'll give you two quick points. One, as I mentioned, is the water pick. It really does an amazing job of getting any of the food debris that's stuck in your mouth.
Yeah.
I'm a big Snickers guy, so staying away from the sticky stuff right after. And if you enjoy a Twix bar or Snickers, all good, but just really go after and clean it. And two is just water, right? So the idea is, let's say you don't have your toothbrush, you're at work, you just ate lunch. Take a rinse out. Just take a real good slosh around, go to the bathroom, rinse around. Don't worry, you don't have toothbrush, don't have toothpaste, all good. But that really washes away the food particles that can contribute to plaque buildup, neutralizes the acids from sugary or acidic foods, increases saliva production, which naturally fight bacteria. So those are two real simple ones. Again, is water pick, and number two, just rinse around. Take 30 seconds after a meal.
Dr. Glick, great advice. Dr. Moshe Glick from the Riverdale Family Dentistry, leading New York City dentist, 15 years plus experience, and really the emphasis, folks, is the need for proactive dental care to prevent a lot of the complications, what we just spoke about, beyond the mouth. Excellent stuff on this day of awareness. This day is World Oral Health Day, this March 20th. Doc, thanks so much. Great job.
Thanks so much, Jay. Be well.
Appreciate it all. 8 o'clock. Let's go.